Public Health is an alliance of the regional associations covering Africa, Latin America, Australasia, Europe, North America, and two which cover South Asia and Asia Pacific. Now, in my presentation, I'm using as a basis these two papers that appeared late last year in the Journal of Global Public and One Health, and in the Journal of Public Health supplement on ethics and law. My proposition really is that the public health community have been naive and lacking in knowledge really about public political influences, not just in our own country, but also on a global basis. And I'll come on to that in a minute. And I sort of couch this as public health in the era of despair, denial, disinformation, despots and disasters. And it's hard enough for us doing our job in public health, doing the health promotion, the health protection and health service tasks. But now those tasks are made more difficult by a perfect storm, really, of global health risks, which don't respect national boundaries and which do affect us all. And those risks are made even greater by the climate of disinformation, which throw us all into doubt, hesitancy and fear. And I say that there's never been a more important time to be in the service of the health of the public, and indeed never a more difficult time, in my opinion. And part of that environment we live in is this disdain for experts. You know, we seem to be the smug pilots who have lost touch with the regular passengers. And this idea that anybody can be an expert, anybody can offer an opinion, and that the profession, the knowledge, the vocation of public health is not widely respected and trusted. So the global picture, though, is one where the world is burning and drowning, and we're seeing flash floods like the one in Valencia from 2024, the LA fires, and we're seeing these related to global warming, the rise in temperature of the climate has been going up now much greater than the levels pre-industrial revolution, and we are above that 1.55 level above pre-industrial, and that's coming alongside this rise in disasters. There's less time between disasters, there's more expensive disasters, and the overall frequency, which we're seeing floods and fires and other forms of so-called natural disaster becoming very much more frequent. Alongside that, we have this phenomenon of climate despair, that people feel they are powerless. They feel that they can't do anything about these big global issues. And yet, for many, climate change is not a future problem. It's causing them to leave their land. It's causing them to be victims of climate even at this time. And we're also seeing with heat waves, for instance, an incredible toll of death from extreme heat. And that climate change does impact on us immediately. The particulate pollution from wildfires, particularly in Canada, that led to so much direct non-communicable disease elevations, the cardiovascular mortality and respiratory disease mortality 90 days after the wildfires in Canada was shown to have greatly increased. And then, of course, regular air pollution from the internal combustion engine and also from domestic oil consumption, estimated to cause between 6 and 8 million deaths per year, the biggest cause of environmental deaths that we know. And these health disasters are related and interconnected with other issues. This is from National Geographic. Climate change, which led to the mass extension of deserts in the Middle East, in Iraq, Syria, led to the migration of farmers who couldn't make a living into the cities, exacerbating shortages of food and bread, leading to the Arab Spring, the riots in major Middle Eastern cities, leading to the wars in Syria, in Libya, and promoting this mass exodus, this mass migration that then led to the rise of draconian policies in Europe and the rise of populist regimes opposed to mass migration. The war is also related not just to oil, but to water shortage, and indeed to other natural resource issues. The map on the left of your screen showing those flashpoints for potential conflict over water. And we've also seen military expenditure rise over $2 trillion a year for the first time in 2022, and now continuing to rise, representing in itself an incredible drain on natural and human resource, which could be better spent on social useful purposes. The public health world has addressed the issues of violence and conflict, and indeed is beginning to address it to an even stronger degree now. This was the faculty's statement in 2016, which is really reflecting some of the aspects that public health can bring to the study of violence, the epidemiology, primary, secondary, and tertiary prevention, the role for public health in response and in conflict resolution, and a role for educational and leadership roles for global public health. And that interest has been is growing again in the current political climate. We're also seeing this potential for the next pandemics. The Intergovernmental Panel on Biodiversity and Ecological Systems describes the next 10 years as the era of pandemics, as natural world is being depleted, the opportunities for humans to come in contact with new and novel viruses and bacteria becomes the greater. And indeed, with the current hantavirus and Ebola, we're again seeing that potential for zoonotic disease to impact on humans. And climate change will force even more contact with microorganisms. Over half of known human pathogens are said to be aggravated by climate change. And in addition to that, biodiversity, the loss of biodiversity is something which has major impacts for us on food availability, food shortage, and other ecological problems that we face. So my question really is, how is it that we haven't been more successful in reducing health damaging behaviour? Why are we not making impact on climate change? Why have we failed dismally to reduce inequality in health? And why have we addressed so little till quite recently what I call the pandemic of adolescent mental ill health? And why are we so missing in action in relation to pandemics and conflict? Well, the reality is that there are political and social constraints. We may not be able to become expert political scientists, but we do need to be aware more of the factors that are influencing the overall development of change in economic and political policies, which so badly influence our state of health at the moment. One of those factors is neoliberalism, which I'll come on to. A group of people described as the sovereign individuals, the rise of populism, and the information revolution has impacted all of these. Neoliberalism, which has been with us really since the late 1930s, two Austrian economists, Hayek and von Mises, published this work. Really, they saw it as an antidote to what they saw as centralization of Nazi Germany. And they described how markets work, but governments don't. And they wanted to cut all expenditure on social causes, deregulate, privatize, and eliminate the idea of the public good. And that philosophy has been impacted on the developing world over many years. But it really only impacted on the Western world from the time of Reagan and Thatcher. And with that 40 years of history in the Western world, we can see some of the impacts that have made it more difficult to keep healthy. Commercial determinants of health. One of the aspects of neoliberalism was a leveling up or a level playing field in which countries could not tax and not regulate, and that global influence of industry would enable the free development of multinational corporations across the world. And with that, we're seeing this impact of what are being described as the commercial determinants of health. The experience of the tobacco industry, where Naomi Oreskes and Eric Conway described in their book, The Merchants of Doubt, how scientists were bought to support the tobacco industry and now indeed support a whole range of health damaging industries. The tobacco playbook was first. We're still being led to believe that tobacco giants want to give us a smoke-free future. And as this article in the BMJ says, pigs might fly. But the tobacco industry has been extremely damaging despite 80 years of knowledge of the harm of cigarettes. The alcohol industry not much farther behind, impacting in this example on drinking and driving campaigns and preventing really effective action. Big Food is picking up the reins of the merchants of doubt. And I'll just use this example. This is the global burden of disease. And it shows you how in the blue boxes, non-communicable disease now accounts for at least 2/3 of deaths in virtually every country of the world, rich and poor. with relatively smaller proportions of infectious and violent causes. And this is the West Midlands view of that. This is again showing that 2/3 mortality due to non-communicable disease. And the burden of disease estimated that something like 25% of diseases were related to food, possibly 40% if you add in alcohol. And this is the 10 corporations who virtually control everything that we eat. So if you think a small local food healthy eating campaign is going to impact on the commercial marketing that these companies put in, it's really likely to be a very limited impact that we can make. But nevertheless, a new harm on the block, big technology. Again, we've been very remiss in tackling the idea of the harms of social media. This article from Byline Times by Caroline Orbueno compares the health harms of the Industrial Revolution and the exploitation of children with the harms of the Information Revolution and the harms again and the exploitation of children. The Global Burden of Disease study in October last year showing that 123 million new cases of mental illness amongst children and adolescents. And what we're seeing is this really disabling impact on young people, particularly through the harmful commercial practices of big technology. And most recently on this front, the Academy of Medical Royal Colleges has described growing up in the online world as a condition as much of concern as smoking. And that report, I do commend it to you. It is extremely damning and deeply disturbing. And finally, in my Merchants of Doubt, big fossil fuel. Undoubtedly the ones who've taken on the greatest level of learning from the big tobacco playbook. The Atlas Network is a network of neoliberal think tanks around the world, funded principally through the Koch Foundation, a fossil fuel funded foundation, which is a major influence on global health and political policies. The Koch Foundation has been implicated. The Atlas Network has been implicated in the election of Javier Milei in Argentina, Bolsonaro previously in Brazil, and of course in Brexit in the UK. And the other example, which I think is a really important one, is the silencing of the Australian referendum to give constitutional rights to Indigenous Australians. That referendum was going to be successful a year up to the referendum. And then fossil fuel money, particularly in the coal industry, came in to back an anti-campaign because the coal industry particularly doesn't want its rights to Indigenous land interfered with. So there are these very dark forces that are putting money into anti-climate change activities. There's some of the ones in Europe. The Global Warming Policy Foundation was influential during the Conservative government, and the Institute of Economic Affairs also benefits from funding from fossil fuel, from tobacco and gambling industries. And the Policy Exchange were funded by ExxonMobil and contributed to Rishi Sunak's Policing Act, which led to restrictions of public protest. And those public protests that led to the GP, Sarah Benn, being suspended from license to practice, and the Lord Walney 16 Extinction Rebellion, people who were thrown in jail for their protests. And of course, that is only the start of what fossil fuel got up to, with the Project 2025 report that was really the blueprint for the Trump regime. That too funded by the Koch Foundation, and through that the Heritage Foundation, the biggest of these neoliberal think tanks. And Russell Vogt there, now the White House Director of Office Management and Budget, he was widely attributed with the authorship of the Project 2025. So if we return briefly to the world of Thatcher and Reagan, we see that over the 40 years really since 1980, average growth, this is an American graph, but there are similar for other countries. Annual growth carried on growing up the dark line, whereas the actual compensation, the workers' wages, if you like, leveled off pretty much. Very small increases in the rewards for labor. And in this report from Unison in Unite the Union in 2024, we see that profit margins over the time from the Ukraine war actually increased by 30% in 17,000 companies. So we're not actually facing a crisis of cost of living, we're facing a crisis of profiteering. And that money is largely the benefit of what William Rees-Mogg called the sovereign individuals, people who are going to gain from the liberation of that the new technology would bring, that they would be able to take the information technology, and move their wealth, move their money at a stroke of a keyboard. And we've seen this in the Panama Papers, the offshoring of wealth, removing it from the pockets, the coffers of governments, preventing us investing in socially needed programs. And those sovereign individuals are probably most reflected in what we now describe as oligarchy, the incredibly rich people who are close to the government and political leaders. Deripaska here, the formerly friend of Putin, and the many oligarchs that live in London being symptomatic of that. And billionaire wealth is no longer just an unfortunate phenomenon. It is very much a public health issue. You cannot earn $1 billion. This is money gained through speculation, often through semi or quasi criminal means. And it is very much an exploitation of some of the poorest in our societies. And now these people are coming for the middle classes as well. And of course, as people's lives get poorer, more destitute, the people living on having to work 3 jobs just to get a bare basic survival, somebody must be to blame for that. And that somebody isn't the billionaires, it's the migrants, it's the minorities, it's the disabled, it's women. And this is where this culture war has now taken off, with and contributing to the rise of populist regimes. And with it goes performative cruelty. I call it cruelty for an audience. We see it with the acceptability of criminalizing homeless people in the street, and with the efforts to put migrants onto barges, and of course in the terrible destruction of Gaza. Alongside all these developments, we are in the age of the information revolution. We're seeing misinformation, which is definable as the false information spread regardless of intent to mislead. And more sinister, we see disinformation, false information knowingly and intentionally designed to mislead. And what we missed, I think, in the public health world is not the reality of misinformation and disinformation. We are very aware of this in relation to anti-vax campaigns and so on. But what we haven't been appreciative of is the industrialization of disinformation, very much a Russian-led phenomenon following 2014 Ukraine war. The idea that you can industrialize the scale of your disinformation, you can take it that you don't have to win an argument, you just have to create doubt. You have to create hesitancy, be it in vaccinations or in elections. And that is very much something which the Russian troll farms have been doing. And in this example, of course, with the use of big technology to influence in elections. And most recently with the Trump election, we've seen the big tech bros not just working in the background to influence decisions, but actually coming up front very much in the process of that kind of industrialized disinformation. And to disinformation, we now have to add information chaos, or techno-feudalism. The tech bros seem to want to make everybody a slave if they're not in the super rich category. Political determinants of health can be important in their own right, not just around what they influence in terms of multinational companies making money. There's corruption, there's personal enrichment, but there's also the drivers of power and autocracy. And in some cases, just what people believe, which may not actually be motivated by money. But what we're seeing with all these developments is actually the dangerous incompetence that goes with not pursuing policies which are about good governance for a country and indeed for the world. We've seen as a consequence of the Ukraine war, we began to see some of this political corruption coming into plain sight. 14 Conservative MPs were directly funded by Russian money. So how we were ever to oppose the invasion of Ukraine is a mystery. But we've also seen other people related to Russian money, one of which, of course, was Nathan Gill, the former leader of Wales Reform. And we are in a very deep and difficult stage of political health. Robert Reich described 5 stages of fascism. rejection of democracy, rule of law, assaults on the press, on the banks, on the lawyers, and the favouring of a strong man man being the operative, who interprets the popular will, galvanizing popular rage against cultural elites, nationalism based on dominant superior race and historic bloodlines, and extolling brute strength and heroic warriors, all wrapped up with this disdain for women and this huge erosion of women's rights that are taking place now. And with that political disdain for ordinary people, we see the use of power in some most disquieting ways. This is the Proud Boys, some of the people who were with on the damage to in the riots in Capitol Hill, the Proud Boys. That guy in the middle there has a T-shirt with 6MWE on it, which is 6 million wasn't enough. And on the other side of the image there, you've got another rioter from Capitol Hill with Camp Auschwitz on his shirt. So, and that trampling on the people has been given real voice with the excesses of ICE. Some of them will actually have been recruited from some of the rioters from the Capitol Hill. And the ICE now has a bigger budget than most countries' total military budgets. So we do face this oppressive authoritarianism, and it's certainly possibly coming our way. So with the polycrisis that we face, the Iran war, we already expect to cause a greater global food shortage, potentially with economic shocks of recession and hyperinflation. Add to that possibly cyber terror, and we are in a period in which there's never been a greater risk of nuclear war than since the Second World War. And more potential flashpoints by miscalculation or by desperation. And the growing super El Nino, which is due to be at its height in next year, is likely to bring even bigger food shortages. And all this taking place at a time when our political leadership is least prepared and least able to deal with single crises, let alone multiple and polycrises. Again, in the US, we saw how poorly the hurricanes of 2024 were dealt with, and what risks the people were put to who were trying to do some good in relation to the emergency response agency. And in the Texas floods last year, we saw sheer incompetence in the part of then Secretary Kristi Noem. They just didn't have the people on the call center to answer life-saving calls. In the pandemic, we saw that the Republican states saw higher levels of deaths than the blue states, the Democratic states, less willing to take up the public health advice on masking, lockdowns, vaccines. And indeed, that similar picture was seen in the other populist states, Hungary, Brazil, and indeed the UK, much higher levels of deaths than Europe and the world. And we see in relation to the threat to, I mentioned the threat to expertise. We don't need expertise. The gold standard science in America is being dismantled. National Scientific Committee members fired, CDC director resigning, an entire committee of experienced people on immunization sacked, and other bodies, environmental science, oceanography, climate science, all being terminated. And it reminds me, 40 years ago in my career, I was battling 2,000 cases of measles in Sandwell. We had one death, and it feels like nothing's changed in my career, or we've gone in reverse. This example here of the second Texas child dying of measles. We once looked to America for policy on vaccines. On the bright side, it seems so far that the hantavirus has been dealt with quite more successfully, I would say, possibly where it was reliant on good science and good organization, despite being involving the two of the countries that pulled out of the WHO. There does seem to have been a reasonable success about that one. And there does, in my experience with World Health Organization, if we didn't have one, we'd invent one. Viruses and microorganisms don't respect national boundaries, neither do multinational companies, actually. We do need a WHO. It doesn't have to be the one that we've had, and there's no doubt that there has been a very substantial loss of life due to the loss of US aid. But in my experience, WHO is regrouping and rebuilding. There is funding coming from other sources that aren't US, and it is something which I believe deserves our support. I'm going to stop with this slide, even though there's a few more to go. But what I learned from all this is that we have to believe that health and quality of life can be better for all people everywhere in the world and for the planet. We have to be keeping up our professional knowledge and be needed and be useful. And we need to have a high level of training and understanding and awareness, and be alert for emergency preparedness. We need to be knowledgeable, we need to be prepared, and we need to be connected as well. Keep up your professional, interprofessional, and community relations. Don't work in isolation in a box. Think global but act local. Think planetary health and One Health, and think inequalities and how to reduce these. I added in this list the First Nation health, because the First Nations, the indigenous populations, are really at the forefront of some of these battles that are going on, the exploitation of the natural world, be it through fossil fuel, be it through soya bean and ranching of cattle. These are people we need to support and need our help. And we need to learn from them how it's possible to steward the world for 50,000 years, not for 250. And we need to understand that geopolitical world in which we live. As I said, we can't all be experts in political science, but we need to know what the motivations are of people that we're trying to deal with. And we need to be aware of what is going on in relation to culture wars, the rise of populism, and the threat of authoritarianism. And I'll finish with this. In my blog for the Global Network in January, I said that we actually needed a renewed moral compass. I was echoing Rutger Bregman and his Reith lectures, but also it feels to me that at a time when expertise is under threat, we need to restate that we're here not just for a nice life. We're here to save lives. We're here to improve people's health, improve the conditions in which people live, and that is a vocation. It's a profession. It's a service. And those are all very unfashionable words at the moment, but we need to restate them and see that we operate to the codes of conduct of our great faculty of public health. And we need to ensure that we at least are acting to try and improve and protect the health of the people. I'll stop there. Thank you.
Thank you so much, John. That was extraordinarily comprehensive, a tour de force, as Zafar described it.